The name of the disease is FSGS, or focal segmental glomerulosclerosis. Now this disease I'll be covering in parts. So firstly I'll be talking about what is FSGS, then I'll briefly talk about the pathogenesis, as it's not that well researched, but whatever I could find I'll be talking with you about it. And then we'll be moving on to a few cases, namely there are about, I think there's just one research done which had about 10 cases studied for this disease pertaining to anabolic steroid abuse. So I'll be covering those cases, and we'll be discussing how what common signs we see in those cases. Then we'll be talking about the treatment modalities that were used in those people, and a specific treatment modality won't be covered here because it's beyond the scope of this video. Now, to very simply understand what is FSGS. So FSGS is nothing but the glomeruli have a scar tissue formation or development, and that causes improper filtration or hyperfiltration of various products. Mainly you will see proteinuria in this case, and this is I'll be inserting an image here. So as you see in this image that the glomeruli are sclerosed, or you can say calcified or damaged in a sense. This condition, and so usually within 6 to 8 years it progresses to end stage renal failure, ESRF. So this is a very serious condition and it needs to be treated depending upon the type of FSGS you are having. Types of FSGS are, so the first type is the primary FSGS, and this is an FSGS where there is no cause. So basically it just happens to be there and we cannot exactly find out what caused it. Then the second type is your secondary FSGS. Now secondary FSGS is the point of focus when we are talking about obesity or anabolic steroid abuse, because it has a cause, it has a secondary cause because of a primary agent. So that primary agent can be anything. It can be a drug toxicity, it can be an infection, it can be sickle cell anemia, it can be diabetes, it can be any autoimmune diseases, or it can be obesity, anabolic steroid abuse, and multiple other factors can cause this secondary FSGS. The third type of FSGS is the genetic FSGS, which obviously, as the name suggests, is a FSGS with a genetic component, and maybe it was present in your family history. So that is the genetic component. Then the fourth type is unknown FSGS. Now unknown and primary are quite similar in their description, because unknown is basically like after development of FSGS and after running a couple of tests, you still won't be able to pinpoint exactly what caused it. So that is your unknown FSGS. Now talking about the secondary FSGS, that is because of anabolic steroid abuse or obesity or any other lifestyle diseases. The basic thing which is affecting the glomeruli or the inside the kidneys is that because of having a higher body mass, which can be either due to being hypermuscular or being obese, which means increased fat mass, which was termed in these studies as a higher BMI, because even people with higher muscle mass will have a higher BMI naturally. So in these people, what is happening is that the hemodynamic stress on the kidneys has increased. So because of this increase in hemodynamic stress on the kidneys, it is causing damage to the glomeruli. Now when there is damage to the glomeruli, there is scarring of that tissue, and that scarring of the tissue is causing a lot of other waste products to leak out per se from the kidney. And the most common finding, as I said earlier, is proteinuria, which is the common sign which you will see in FSGS. Now what happens here is that because, as I said, of the increased hemodynamic stress, scarring of the tissue, proteinuria, seen in obese people, hypermuscular males, mostly in males, it is more common than females. And above that, with damaged kidneys, you're having an increased protein intake of more than like about 300 to 400 grams per day. In some cases, it was even found that the patients were consuming 500 grams of protein a day. Now, don't confuse this with the fact that protein is causing injury to the glomeruli or to the kidney. It is not a cause. Excessive intake of protein, or rather high intake of protein, is not a cause of kidney damage. First of all, let me clarify that the kidney was damaged because of other agents which I have stated, and as the kidney is already damaged, a higher protein diet in later stages of kidney failure or later stages of kidney disease is a negative factor. Rather, I would say that even in stage 1 or 2 kidney disease, kidney failure, we usually advise patients to have good amount of protein. But in later stages, we ask the patients to pull back on the protein to about just 40 grams per day. But this has to be considered that in the patients with FSGS, the kidney is already damaged. So if the kidney is already damaged, then then a higher intake of protein can be problematic for the patient. Now, talking about the pathogenesis of FSGS, there were two factors which were responsible mainly, that is SUPAR, that is SUPAR, soluble urokinase receptor. It was found to be high in about 2/3 of the patients who were suffering from primary FSGS. And even after transplantation, they developed FSGS again. And in these patients also, the SUPAR or SUPAR was increased. Another component which was found to be a likely candidate was your cardiotrophin like cytokine 1 receptor, and this was also increased in these patients. These are the two most legible candidates for causing FSGS. Now on my screen you will be seeing a few cases which I'll be pulling. So here I'll be discussing those cases with you. About 10 cases are present. I'll briefly discuss about them. So as you can see here that we have a patient of 30 years of age, and all of them were males because it's a more common disease in males and more researched in bodybuilders and some powerlifters as well. And they all were having, if you see a common trend, that the age group which was affected was mostly between 30 to 45 years. And if you see here that the BMI is high in all of those candidates. Now this high BMI is mainly because of a combination of high amount of muscle mass and high amount of body fat percentage as well. But it has not been exactly mentioned whether it was fat mass or muscle mass. But assuming the exercise and the usage of hormones and the diet, we can assume that they were hypermuscular. So looking at the first case again, now he had a very high BMI of 41 because obviously he's a bodybuilder, a huge bodybuilder of 134 kilos. And you can see that he has a history of having some amino acid supplements according to him, of extremely high protein diet. If you see more than 550 grams per day, that is insane. And the hormone usage is anabolic androgen steroids, including M1 testosterone pro hormone he's using, growth hormone and insulin for more than 10 years. Now the dosage here isn't mentioned because this is the key. The dosage is the key when it comes to abuse and use. But again, we'll not be going into the dosages over here. Another added component of having high BP. Again, for the second case as well, if you see, he was using stanozolol and durabulin for about 8 years. Again, a high protein diet, that is okay. And hypertension was very brief, like just for 3 months, so that is not a very big cause of concern. Then another, if you see in all the subsequent cases, that anabolic androgen steroids and growth hormone for 20 years. For some, there was a mention of the dose as well, if you see. Sustanon, durabulin, primobolan, equipoise, vinsterol for years, not specified exactly. We are seeing that there is a chronic history of usage, and most likely they had been abusing these because the dosage has not been mentioned, so we cannot exactly say. about how much they might be taking. Now, this was a group of cases. Now, a particular case which I'll be talking about was a basis of the entire study done by the doctors for this case specially. So now in this case, that is the first patient that we had seen in that list was a 30-year-old white male, and he had again a history of high protein intake, usage of supplements such as growth hormone, insulin, methyl 1 testosterone, which was taken orally, and he was also using other anabolic androgenic steroids which we do not know about. Now, apart from the different parameters, blood panels and most of the stuff was fine with him, except that his creatinine levels were extremely high. His BMI was extremely high, and other markers were absolutely fine. Protein was extremely high in his urine. Urine protein was high. And on further examinations and taking biopsy, we found that there was presence of FSGS, secondary FSGS. Now, this secondary FSGS, after obviously when the patient was diagnosed with it, they started him on therapy of ramipral and valsartan, which caused him, and obviously they advised him to not take any more supplements or even reduce his protein intake and reduce his exercise regime. They pulled everything off, and as a result he lost his muscle mass, he lost his mass as well as, and after that his parameters were checked again and they had improved considerably. Now the psychologically and impacted a lot because of this sudden loss of muscle mass and lack of training. So even against the nephrologist's advice, he went on to train. He consumed the same amount of drugs, just the dosages as per this case study had been decreased, I think, and he even reduced his diet, but he was gradually increasing it. And to no surprise, the parameters again went through the roof. His creatinine got out of control, his proteinuria was more, and even his kidney damage was increasing yet again. So then again, after that, the doctors concluded in this study that they were proposing that secondary FSGS was caused because of anabolic androgenic steroids. In this case, which was a primary study done for this, and they have said that it concluded that there was potential direct toxic effects on the glomeruli because of the drugs. So to conclude this, and with very limited research available on the topic and what I could find, so based on this, what I conclude is that, so obviously the usage of the drugs needs to be monitored, and if you take the decision to use, you need to do it under proper guidance, under a coach who knows what he's doing, and even self-awareness is needed, because whatever decision you take is up to you in the end. There should be no judgment as to what you want to do in your career or how you want to take it ahead, but smart usage, the smart game needs to be there. You need to be aware about it, and you need to work with people who know what they're doing, because in the end it's just one life, and if you go down the wrong path, especially in this case, you can create a recipe for disaster. So anyways, this was the case presentation. If you liked it, do share it with other people who might be sharing the same interests, and share it with even the people who don't know about this disease or lack awareness. So it would be really appreciated. Also comment down if anything more you felt that I could have added about it, and what are your views on this disease. And so that's all for the cases. So it was a really nice response I had when I posted on my stories, and I got a really good response for making this video and for making such more cases. So I'll try to find and bring the best I can. So signing off, the Strand Doctor.